Hi everyone, it's Mairead here from Arra Vet. So we're going to discuss diabetes today. The first thing that I'll go through is the clinical signs of diabetes. So if you notice that your pet is drinking a lot of water, so if they're excessively thirsty, hanging over that water bowl, always looking for water. The other thing is peeing a lot. So sometimes those pets will start having accidents in the house and they never had accidents before. This isn't your pet being bold or naughty. This is your pet is drinking too much and peeing too much. The third classical sign of diabetes is excessive hunger. So eating all the time but losing weight. This is a typical sign of diabetes where the dog or the cat is hungry but still losing weight. It doesn't make sense. So they're the typical clinical signs that you need to watch out for. Today we have Ruby with us, and myself and Ruby were here to maybe discuss a little bit about diabetes. So Ruby has recently been diagnosed with diabetes. Diabetes is a condition where the glucose in our blood isn't being absorbed properly and used by the cells. This is due to a deficiency or a resistance to the insulin. So there's two different types of diabetes. Like I was saying, there's a type 1 and a type 2. So type 1 diabetes is where the body isn't producing enough insulin anymore. So this is damage to the pancreas. Type 2 diabetes is a resistance to the insulin. So what this means is the dog is producing insulin, but the cells are resistant to it and they're no longer responding correctly to the insulin. When we don't have enough insulin in our body, what happens is the lock into the cells isn't opened for the glucose to be absorbed. So what happens then is the glucose levels in the blood are really high and they're not getting into the cells, so the dogs become really tired and they drink a lot of water and they are really hungry because they have no glucose in their cells, so they eat loads and they lose weight. So then the control of the diabetes is injections. So Ruby has to get injected twice a day with insulin. So she's getting an injection at 8:30 in the morning and 8:30 in the evening. Her owner is doing a really good job of controlling her feeding because she has to get 2 meals a day, one in the morning and one in the evening. So this is to control her glucose all day long. And so what we might do in the video now is show you how to give an insulin injection correctly, and we'll also show you a blood glucose curve.